Did you know that fibroids are one of the leading causes of infertility in women? And fibroids always appear in different ways that someone needs to know before they opt for treatment, before they opt for any medical intervention. We are talking about fibroids. What are fibroids? What causes them and what brings them? And all about them. In this particular video, we're going to know what are fibroids, what brings them, how can they be managed, how can they be treated, and how to prevent them, and see what brings about them. Welcome to Dr. Malik Discussion Health Discussion Show, a channel or a discussion where all your medical concerns are answered. So, yes, looking at this is a picture that shows different body masses, different masses in the female reproductive system, because ideally these are not supposed to be there. These are not supposed to be there. So by definition, fibroids are non-cancerous or benign swellings within the female reproductive system. So from today onwards, you take it all know that if the swelling is not cancerous, if it is not malignant, it is a fibroids. That's why we call them uterine myomas. We also call them uterine myomas actually. Fibroids are non-cancerous or what we call benign swellings within the female reproductive system. So that is the definition. That is the definition. Now we need to look at what causes these non-malignant or these benign or non-cancerous swelling within the female reproductive system. What causes them? What brings about them? Why do women get them? Why do you find these days a young girl getting fibroids? Why would an old woman get fibroids? Why are you there and you were told that you have fibroids? Did you know where they came from? Oh, if you are at risk of developing fibroids, do you know that risk? Do you know about that risk? Do you know how to control that risk? Okay. Now, fibroids, when we look at the causes of fibroids, one, there's what we call idiopathic. Now, idiopathic means someone can be there, very normal, everything functional, no nothing, no anything, and then boom, you test it and you have a fibroid. You test it and they tell you you have a swelling. And you need to differentiate this swelling, the swelling of the cysts of polyps from fibroids. They're different. Apart from the idiopathic that comes abruptly without any medical history of any condition, we need to look at the risk factors, because risk factor is something or a lifestyle or anything that you do that exposes you to getting a certain disease. So now, the risk factors of getting fibroids are mainly based on prolonged exposure to a hormone called estrogen. There's a hormone called estrogen within our body, but specifically produced on the ovaries. These are the ovaries that produce the hormone called estrogen. So a prolonged exposure to a hormone called estrogen in your body exposes you to getting fibroids. So what are the things that make your body get exposed to estrogen for so long that it reaches an extent of bringing fibroids? Now, before you know that, there are two hormones that you need to understand that exist in a female's body. Specifically here we're talking about the female or the woman. There are two hormones that you need to look at or understand. When you understand these hormones, it is very easy for you to avoid the things that can expose you to prolonged estrogen exposure. There is progesterone hormone and estrogen hormone. These are parallel hormones that when this one is here, okay, this one counteracts the effects of the other one, or they work parallel to each other. Something like that, like co-wives. They work parallel to each other. Progesterone hormone ideally prevents someone from getting fibroids, and estrogen hormone ideally promotes someone towards getting fibroids. Progesterone hormone is also called a pregnancy hormone. Why? Because when a woman gets pregnant, the placenta that has formed, the placenta produces the hormone called progesterone to maintain the pregnancy. That's why we call it a pregnancy hormone. So when you have an exposure to progesterone hormone, you're less likely to getting fibroids. That is why people who have produced a number of children usually don't experience fibroids as compared to the people who have not produced. Because when the moment you get pregnant like this, your body gets a saturation of progesterone hormone to support the pregnancy. Therefore, the curve of estrogen hormone, the progesterone hormone, is always high. Therefore, you have a whole phase of exposure to progesterone hormone for 9 months, which reduces the risk. So, in that case, let us look at the risks that exposes someone to getting estrogen hormone for so long. 1, prolonged period without getting pregnant. If you have taken long without getting pregnant, you're likely to get these things. Why? Because you have less exposure to progesterone hormone that would otherwise prevent you from getting them. So the body creates these masses, what we would call like pseudo babies, so that the body itself creates these masses so that it thinks it will get that hormone progesterone, when in normal cases when it cannot actually happen. So it creates pseudo babies. In short terms, it creates fibroids. Okay, so when you take long without getting pregnant, you are very much likely to get these fibroids. You are likely to get these fibroids. There's what we call early menarche. Early menarche means when a woman or a girl starts her periods at a young age. When she starts her periods at a young age, probably 8, 9, 10, it's because you calculate, you know that once someone starts periods, there is that exposure. There is that estrogen hormone that is produced every month. So there is, when a woman starts periods at a young age and takes longer still without getting pregnant, or even if has not taken longer, there are chances that this woman will get fibroids. Not always, but it is one of the risk factors, basing on the principle that I've told you of exposure to, what? To that hormone, estrogen. Then there are genetic factors. There are those people who are born and in their family they say, my mother had fibroids, and my grandmother had fibroids, and my grandmother had fibroids. So it becomes like a family problem. Why? Because within their genetics, one of the things that they do, one of the things that their genes do is produce excessive estrogen as compared to other people. So that is also another cause that can bring about these fibroids, Women who are aged 35 years and above, and these women who don't have babies or who have no children, or who have taken so long without getting another baby. For example, the woman got a child about 20 or 15 years ago, and she's approaching 35 years without another baby. There is also another risk factor of developing. There is deficiency of vitamin D. Yes, some women with lack of vitamin D have developed fibroids. It has been confirmed that some women with lack of vitamin D deficiency have got fibroids and are at a risk of developing fibroids. Then we look at obesity. But what won't our obesity bring? Or obesity can bring all the negative effects. Obesity is excessive weight. Actually, calculating obesity, we consider someone's BMI, or body mass index. So that is a proportion or a ratio of someone's weight in respect to the height. Weight in respect to height. So if your BMI is high, your body mass index is high, exceeding a certain threshold, you're likely to get fibroids. So you should note that. Not those factors, some of those factors that expose someone to getting fibroids. Before we look at the signs and symptoms. What are the signs and symptoms of fibroids? Signs and symptoms of fibroid depend. Most of the fibroids, did you know that they are asymptomatic? Asymptomatic means you are there and you don't feel any symptom. You are actually very well. You don't even know that you have fibroids. Yet they are there, or they are there starting to grow, or they are starting to come out, but you don't know. So most of the signs and symptoms, most of the fibroids can seem to be asymptomatic, especially if they're in the first stage, they are asymptomatic. Now, the second sign and symptom is LAP, what we call LAP, or lower abdominal pain. I'm not talking about this side of the abdomen, this abdominal side or the upper part. I mean the lower abdomen. More of like the pain that a woman gets when she's in her periods. Now that is lower abdominal pain, not the upper pain of the ulcers and the heart and all those things. Lower abdominal pain means pain on the pelvic region, on the pelvis, or the female reproductive system region. So when you get occasional pains, on and off pains, especially when you're in your periods, and the pain seems to be so much, the pain seems to be so much, get worried, get concerned. The other thing is prolonged or heavy periods. There is that sign and symptom of prolonged and heavy periods to people who have fibroids. Because everything might seem to be okay, your stomach is in the normal shape, but then you have prolonged periods, the periods that take long to end. You go in your periods and it goes from 3 days to 5 days to 7 days to 10 days to you've been in your periods for long. And sometimes they are not even long, but they are also heavy. You're in the periods and they are also heavy. You even reach an extent of becoming anemic or even taking medicines to stop the bleeding, they cannot stop. Then there's what we call pressure symptom. Pressure symptom means comes with frequent mucitulation or frequent urination. When you over-urinate, you're over-urinating over and over again. They check you for UTIs and you don't have. Or they check you for UTIs and they tell you have moderate UTI, you have very small cells, but then you think about doing the test that check for fibroids. Think about the test that check for fibroids, because you could be having an underlying fibroid and you don't know. How does this pressure symptom come about? When you have a swelling within your abdomen, your uterus, this swelling pushes the bladder, so the space within the bladder reduces, and you feel like you want to urinate all the time to empty the bladder. So you end up getting what we call pressure symptom. There is what we call infertility or failure to conceive. Yes, people who have fibroids have shown a difficulty time failing to conceive. Like I told you, I'm not saying that uterine fibroids are the only causes of failure to conceive, because there are many causes. There are hormonal causes, there could be stress causes, diseases like polycystic ovarian syndrome, and I have made videos about all these things. Diseases like polycystic ovarian syndrome, diseases like endometriosis, and blocked tubes, and uveitis, diseases of the ovaries, and all those things. But specifically in this case, if you're failing to conceive, also consider checking to see if you don't have fibroids to make sure that it is not the cause of your failure to conceive. Because when you have fibroids, the environment that is not okay, the environment that is not friendly for implantation to take place in your uterus, the environment that is not supportive for the implantation to take place within your uterus, so you end up unable to conceive. Sometimes even fertilization takes place, but then you get what we call chemical pregnancy, that comic abortion, that you get it and then it flashes out immediately. You don't even notice that you have pregnancy, you got pregnant. Okay, something like that. Now, how do we check? How do we test to ensure or to see or confirm that someone has a fibroid? We do what we call ultrasound scan, abdominal ultrasound scan. Abdominal ultrasound scan. This may be of a color Doppler, where we want to see if there is a blood supply, if there is vascularization or blood supply, or nanocolor Doppler, whereby we see and identify the masses and know the type, the extent, and the levels and the size and all those things. Abdominal ultrasound scan, which may be color Doppler or nanocolor Doppler. There is what we call HSG, hysterosalpingography. Hysterosalpingography. It is when we put a chemical, it is a contrast, like a liquid contrast, within your uterus, and we take you an X-ray to see the extent, to see how blocked, if they have led to blocking of your tubes, if they have led to blocking of if they have occupied all your uterus space or uterine cavity. So it is HSG, hysterosalpingography, is also a test done to look at the uterine fibroids. Then we check for estrogen hormone. We can do a hormonal profile assay. to check for your estrogen and the levels. This can also be important to people who are at risk of developing fibroids and would not want to develop a fibroid. We do that test and we see the levels. If the estrogen hormone is high, we know what to do for you. We know what to do for you to prevent you from getting those fibroids. Now, when we look at the treatment options, how do we treat fibroids? What are the treatment options for fibroids? Okay, fibroids have two major treatment options. They have two major treatment options, and these options depend on the type, on the size, and on the extent of the fibroid and the size, and also the fertility intentions of the woman. Since we have the medical treatment whereby you swallow tablets or we put you some devices in your body, or surgical treatment whereby we have to open here and then remove this fibroid and remove this fibroid or this that remove. Within the treatment options within the treatment options, the medical side, non-surgical, we look at hormonal replacement therapy. This is where we give someone treatment that is enriched in certain hormones in order to either help in shrinking, exposing someone to hormones like progesterone. So it becomes important, since we have known and looked at the risk factors as someone having too much exposure to progesterone, estrogen hormone, we use this to prevent. Then there is some treatment that is rich in that looks at GnRH. There's also that treatment option, but it also depends on the type and the extent and the size. Then there is what we call intrauterine device. That is not the copper T, however the POP, progesterone only intrauterine device. We can use that. We put some device that is rich in the hormone progesterone, and in the long run it prevents you from getting, or it helps in shrinking back the fibroids. When we look at the surgical intervention or the surgical management or treatment in fibroids, we have two types. These types will depend on a lot of factors. One, the shape, the extent, and the location of the fibroids. It's on these factors that will depend, and also most importantly, the fertility intentions or the reproduction intentions of this woman. We have two types, like I said. We have what we call a myomectomy. This is simple. Myomectomy, we just open here. We just open the woman's uterus, the lower belly and the uterus, and we remove the fibroid. And we close, simple. And we close. Just like that. It ends. Then there is what we call hysterectomy. Hysterectomy is when we have to remove the fibroid, but plus part or all of the uterus or the reproductive system. The uterus. What does this mean? There are fibroids which have invaded your whole reproductive system, and they are all over, and there is no way you can remove only one or two. That would require whole removal. So you cannot do this to a woman who is willing to produce again. But however, a woman who is not willing to produce again, maybe is even in menopause and all those things, this woman can opt for that. Then sub is when you we open and remove some part of the reproductive system, for example, some part of the uterus. So all these treatment options need to be fully discussed with the doctor. They need to be fully understood by the patient, that the patient is either going to swallow tablets, the patient is either going to get an injection, the GnRH, the patient is either going to get intrauterine device, or the patient is going for a surgery. And if it is a surgery, is it going to be a simple myomectomy? Is it going a total removal or a sub removal? So after understanding all that, after knowing that, you can always know how to prevent them. And if you have any suspicions, you can always go to the credible facility. They do the checking on you. They do checking on you and find what the cause is, and find if the fibroids are there, and find if they are if you are at the risk of developing them. You can always do that. And we also thank you for following, for subscribing, and for liking all the videos, because we have got a lot of positive feedbacks, a lot of questions, and a lot of thanks, because this shows that people are appreciating, it shows that you are appreciating the content and you're following. Don't forget that you can always leave your questions, you can always ask us your questions, send us the WhatsApp messages and ask what you need to know. We shall be there to answer you. We shall be there to answer you. And also don't forget to subscribe, because when you subscribe, it alerts you, it lets you know the videos that are going to come that could be very important for you or your neighbor or anyone that needs the help. Thank you.